All right, so we've got another one of these plantar first metatarsal head. So that's the metatarsal head right there. Calluses. So what we do is basically make sure it's not a wart or anything. First, you can see it's a little bit rough there, but we've done this one before, so this usually just cleans up and it's usually just a callus under here. So remove all this really thick and rough skin. Now, of course, these are caused by pressure. So it's where the foot rolls in and then it causes pressure under this metatarsal head. So of course, trying to prevent this, what we do is relieve the pressure because that's the cause and treat it regularly, use some moisturizer. Make sure we try and, so the regular treatment actually helps to break the hardening cycle of the skin, because when we put pressure on the skin, it causes thick skin, and then the thick skin causes more pressure, which causes more thick skin. So you get this positive feedback loop is what we call it, and you get this really accelerating of the thickness and the growth of the skin. So you can see we're cutting through all of that, and there's no warty tissue at all. Warty tissue usually looks more like cauliflower, and if we cut it like this, it'll bleed. And it bleeds in a really particular way. It bleeds with pinprick hemorrhages, and so it looks like we've taken to it with a needle or something. But like I said, we've done this one before, so we pretty much know what we're dealing with. You can see there's a bit of tissue breakdown there, so that's why we do this one regularly. And then, so yeah, the treatments for it are obviously wear a good supportive shoe, an orthotic insole. If you're wearing work boots, get a work boot that's got cushion midsole and an arch support insole like the Ergonx work boots that we sell. And of course, regular treatment, a bit of moisturizer, and wear shoes as much as you possibly can. So just try and get a little bit more of that out there. That looks like there's still a little bit of blood there. And that's, so we'll sand all that up and then put some moisturizer on that, and then we'll review this one in about 6 or 8 weeks' time.